Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today, I wanted to come on and do a video about fibromyalgia and how that can be related to mental health conditions like PTSD and VA disability. I've had a few people ask me about this. One veteran in particular has been very kind and sweet, and she has asked me to make a video on this a couple of times. So I wanted to oblige and create this content, and hopefully it will help her and some other veterans with taking a look at some of the research that I use that you may be able to take to your treating provider so that they can help you with a medical opinion if they so see fit. So just a disclaimer, I'm not an accredited claims agent, VSO, or attorney. I don't represent veterans in their pursuit of VA disability, but I do assist with medical opinion letters at times, which are never required, but can sometimes be helpful in your pursuit of VA disability. So now that we've gotten that out of the way, let's talk about what fibromyalgia is, okay? So the CDC describes fibromyalgia as a condition that causes pain all over the body, so widespread pain, sleep problems, fatigue, often emotional and mental distress. And people with fibromyalgia may be more sensitive to pain than people without. It's called abnormal pain perception processing, and fibromyalgia affects 4 million US adults and about 2% of the adult population. What are some of the signs and symptoms? Pain and stiffness all over the body, fatigue and tiredness, depression, anxiety, sleep problems, problems with memory and concentration, headaches, sometimes including migraines. Other symptoms may include tingling or numbness in the hands and feet, pain in the face or jaw, digestive problems. So there's a lot of risk factors the CDC lists as well. So age, it can affect people of all ages, including children. However, most people are diagnosed during middle age, and you are more likely to have fibromyalgia as you get older. People that have lupus or rheumatoid arthritis. Some other factors can be your gender. So women are more likely to have it than men. Stressful or traumatic events, which we're going to get into. Illnesses, repetitive injuries, family history, and obesity. So there are specific diagnostic criteria that they will go over your history, physical exam, x-rays, and blood work. So beyond that, let's talk about PTSD. So I'm going to pull up some of my literature that I use showing the relationship between those conditions. All right. So there's a study called Post-Traumatic Stress Disorder and in Fibromyalgia Syndrome Prevalence, Temporal Relationship between PTSD and fibromyalgia symptoms and impact on clinical outcome. That was published in a periodical called Pain, and it discusses the link between the two conditions. Most burdensome traumatic experiences and PTSD symptoms are described as the onset of chronic widespread pain in 65% of patients, 29% of patients, most burdensome traumatic experience and PTSD symptoms, followed by the onset of the disorder, and 4% of patients, most burdensome traumatic event, and PTSD are linked in several ways, and that PTSD is a potential risk factor for fibromyalgia and vice versa. So there's a bidirectional relationship. Another study, Neurology of Fibromyalgia and Chronic Widespread Pain, that was published in 2017 in Neuroscience, discusses stress and physiologic factors playing a role in the development and severity of fibro. There's some really good, I'm not going to read off the entire thing here, but check that article out. So it discusses stressors as triggers and affecting the severity and the development of the condition. So let's talk about another one, potentially traumatic events, post-traumatic stress disorder and post-traumatic stress spectrum in patients with fibromyalgia, published in 2019, shows how PTSD is a significant causal and exacerbator of fibromyalgia. The results show that fibro patients with PTSD report more potentially traumatic events, avoidance symptoms, numbing, arousal, maladaptive coping, and personality characteristics compared to patients with partial or without PTSD. These results could indicate that loss and or trauma events represent a risk factor for the development of symptoms of fibromyalgia in genetically predisposed individuals. I have several more articles, but I'll just throw two more out there for you guys to take a look at. Post-traumatic stress disorder, tenderness, and fibromyalgia syndrome, are they different entities? Published in 2006. And then psychological stress and fibromyalgia, a review of the evidence suggesting a neuroendocrine link, published in Arthritis Research and Therapy. Good Lord, there's so many articles about this. One more. Psychological impact of fibromyalgia, current perspectives. And those are some good ones for you guys to jump on and take a look at and review and see that relationship from a causal standpoint, an aggravational standpoint, the bidirectional relationship between the two. And I hope this was helpful. Please let me know if you have any more questions. There's some other great videos or some great content about fibromyalgia and weight gain as an intermediate step. Fibromyalgia related to Gulf War. That's another one I see a lot of veterans have that related to Gulf War exposures. And please let me know if you have any questions or comments. I hope you guys enjoyed this video, and thanks for watching. All right, see ya.